Hello.
Hello.
How are you?
Fine, thank you.
My name's Mallory. I'm a Texas State Nurse Practitioner student, and today I'll be doing your assessment.
Okay.
Go ahead and put your arms on mine, please, or your hands. Great. Skin appears warm to touch. Skin is free of moisture or exudate. No lesions noted. Skin turgor is good. I have brisk capillary refill, +2 to the nail bed, with no clubbing or cyanosis present. And if I did have lesions on the body, I would be using the ABCDE acronym. Great. You'll hold your hands out like this. I'm going to be checking radial pulses. Great. Radial pulses are palpable, +2 bilaterally. Great. Brachial pulses are palpable, +2 bilaterally. Hands out to the side here. No edema noted, no deformities or lesions. Any tenderness there?
No.
Great. Now copy what I do, please. Fingers like this, like flashing, and then hair out to the side and in, and fingers up. Good. Wrists up and down. Roll them around. Elbows up and down to the side, back and forth. Shoulders out. Shoulders out in front. Great. Full range of motion is noted in the upper extremities. Go ahead and shake my hand. Shake my hand. Fist. Push against resistance. Other fist. Push against resistance. Elbows up. Push against resistance. Good. Shoulders out. Push against resistance. Great. Full, no weakness noted, +5 in the upper extremities. At this time, I'm going to test your reflexes. Great. Reflexes present, +2 in the biceps. Reflexes present, +2 in the triceps. And reflexes +2 and present in the brachial radial area. Go ahead and put your finger to your nose. Other time, go a little faster. Great. Hands on your legs. Go out and in, faster, 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 faster. Great. Now, if you'll lift your arm up a little bit, I'm going to be palpating your axillary now. Any pain or tenderness?
No.
Any pain or tenderness?
No, ma'am.
Great. I'm going to wash my hands now. We're going to move on to your scalp, sir. Scalp appears symmetrical. Hair distribution seems symmetrical and evenly distributed. Now palpating the scalp. Any tenderness, sir?
No.
No lesions or deformities noted. Go ahead and frown. Frown. Puff your cheeks out. Great. Cranial nerve 7 is intact. And now I'm going to move on to palpating and percussing your maxillary and frontal sinuses. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Any pain or tenderness?
No.
Now I'll be listening to the temporal artery with the bell of my stethoscope. Temporal artery is free of bruit bilaterally. I'm going to be using this across your face, sir. Those 6 spots, do they seem symmetrical on both sides, the same amount?
Yes.
Okay, great. Cranial nerve 5 is intact. At this time, I'm going to be inspecting the eyes and checking your corneal light reflex. Corneal light reflex is present. Pupils are equal and round and reactive to light, both consensually and directly. And on accommodation and convergence. If you'll go ahead and look at me and follow my fingers. I just used the 6 cardinals of gaze, and cranial nerve 3, 4, and 6 are intact. I'm going to go ahead and palpate your eyes. Will you close them? Great. No lesions are noted. Any pain or tenderness?
Nope.
Okay, go ahead and open. Checking your conjunctiva, which is pink. Your sclera is white. No jaundice noted. Pupils and cornea are intact. And at this time, I'd be using my ophthalmoscope. I would be making sure red reflex is present bilaterally, retina was not detached, no leaking blood vessels, and optic disc was visible. At this time, we're moving on to your ears. Ears appear symmetrical on both sides. No lesions noted or deformities. Palpating your ears. Any pain or tenderness?
No, ma'am.
The mastoid process. At this time, we're going to be doing the whisper test. I'm going to be saying letters and numbers on either side of you with one of your ears occluded, and you're going to repeat what I say. I'm going to stand on this side. Please close your right ear.
2, 5, 8,
C,
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 10.
10,
Great. Now this side.
5, 10, 8, A,
C,
C,
D.
D.
Great. Cranial nerve 8 is intact. At this time, I would be using the otoscope to look inside the ear. I would want to see a pearly gray tympanic membrane. I would want to be able to see the malleus, the handle of the malleus, and the cone of light reflex present. In a pediatric patient, the external auditory canal is facing upward, so I would want to pull down and back at the 6 to 9 position to be able to correctly identify the canal. Also, I could use the Weber test. That checks for lateralization, and I would be using a tuning fork in the middle of the skull here. Now I'm inspecting your nose. Nose appears symmetrical. No lesions noted, no deformities noted. Palpating your nasal ridge and tissues. Any pain or tenderness?
Nope.
Go ahead and plug one nostril. Breathe in. Go ahead and do it to the other side. Breathe in. There's patency in both nostrils. Cranial nerve 1 is intact. And at this time, I would use a speculum to look inside the nose, but I'm going to be using my pen light. Great. Nasal mucosa appears pink. No bleeding. No polyps or lesions noted inside the nose bilaterally. At this time, we're moving on to your mouth. If you'll go ahead and open your mouth for me, sir. Great. Buccal mucosa appears pink. Teeth appear to be in good repair. Hard and soft palate are visualized. Tonsils are visualized, +1s, and no inflammation noted. Go ahead, say ah. Great. Cranial nerve 10 is intact. Tongue rests midline. Cranial nerve 12 is intact. Stick your tongue out for me. Great. Cranial nerve 9 and 10 are also intact. Okay. Go ahead and move your tongue to the side of your cheek. This side. And this side. Great. Now I'll be palpating for your TMJ. Any pain or tenderness?
No.
Go ahead and open and close your mouth. Great. No popping or clicking heard. And normally I'd be wearing gloves now, but I'm going to be palpating your mouth. No bleeding gums. No lesions noted. I'm going to be washing my hands now. moving on to your neck. Neck appears symmetrical. Skin is intact. No pigmentation changes. Go ahead and swallow for me. Great. Thyroid rises as patient swallows. This time I'm palpating your neck for any lesions or deformities. None are noted. Any pain or tenderness?
Nope.
Okay. Moving on to your lymph nodes. I have the occipital lymph nodes, the postauricular, the preauricular, the submandibular, the submental, the supracervical, the posterior cervical chain, the deep cervical chain, and the supraclavicular lymph nodes. Any pain or tenderness?
No, ma'am.
Now I'm going to be palpating your carotid pulse. Carotid pulse is +2, palpable bilaterally, and now listening for any breathing. Great. No bruit heard bilaterally in the carotid pulses. Now moving on to your trachea. Trachea appears midline. I'm inspecting now for the thyroid. Thyroid gland appears to be, thyroidectomy seems to be happening. I see a scar here. Palpating for the left lobe. Left lobe is not there. Right node there. No lesions noted, no deformities noted in the thyroid. Go ahead and move your neck up and down, side to side, laterally. Great. Neck is intact. Go ahead and shrug your shoulders against resistance. Push against resistance. Good. Cranial nerve 11 intact. Move your chin to my palm here. Chin to palm. Great. Go ahead and come down here for me, sir. And you'll be facing away from me. I'm inspecting the posterior lung fields. Skin appears symmetrical, no pigmentation changes. Patient is using no accessory muscles, no retractions are being seen. AP and transverse diameter are proportional. Patient does not represent or present with dyspnea. Putting my hands around you. Take a deep breath. Lung expansion is symmetrical. Now I'm percussing the lung fields. Lung fields are resonant. And now I'll be listening. Breathe in, breathe out, 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 laterally, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Posterior lung fields and lateral lung fields are normal. No rhonchi, wheezes, stridor, or rales heard. Now I'm going to check for CVA tenderness. Any pain or tenderness, sir?
No, ma'am.
Great. If you'll go ahead and face me now. Great. Just going to move you back here. Looking anteriorly now at the chest. Chest appears symmetrical. No pigmentation changes. Palpating in the chest, 4 different places. 1, 2, 3, 4. Any pain or tenderness?
Nope.
Checking skin turgor, and it's good. Breathe in, breathe out, breathe in, breathe out, breathe in, breathe out, breathe in, breathe out. Great. Anterior lung sounds are normal. No rhonchi, wheezes, rails, crackles, or stridor. Okay, we're gonna go ahead and get up here now. I provided you a pillow and a towel. Okay, go ahead and lie down, sir. Inspecting the precordium. Precordium is without heaves or pulsations. Palpating the precordium. Any pain or tenderness?
No.
Now I'm going to be listening. Okay. I have the sternal notch, the manubrium, the angle of Louis, which is connected to the second rib, and the aortic area is in the second intercostal space, right sternal border. And then I have the pulmonic, which is in the second intercostal space, left sternal border. Urge point, third intercostal space. Tricuspid, fourth intercostal space. And then I have the point of maximum impulse, which is also the mitral valve, which is in the fifth intercostal space, left midclavicular line. Patient's heart rate appears regular rhythm at 74 beats per minute. S1 is heard greater over the mitral valve, and S2 is heard better over the aortic and pulmonic valve. No rubbing or clicking is heard. At this time, I'm going to be listening in to all 5 spots with my bell. I have the aortic, pulmonic, herbs, tricuspid, and mitral. At this time, I'm inspecting the abdomen. Contouring is good. Abdomen appears symmetrical. There are slight pulsations noted around the umbilicus. Go ahead and lift your head, sir. Great, able to do that without resistance. Go ahead and lift it again while I inspect your abdomen at the same time. Good. Okay, you can put your head down. Listening in all 4 quadrants. Vowel sounds are active, ×4. And now with my with my bell, I'm going to be listening for any bruit in the aortic area, the renal area, the iliac area, and Freya Brewy in the aortic, renal, and iliac areas. Now I'm going to be percussing the abdomen. Abdomen is producing tympany, which is what we want to hear. Light palpation, any pain or tenderness?
No.
Deep palpation, any pain or tenderness?
No.
Now palpating for the liver. You can feel the lower edge of the liver, palpating for the spleen. Unable to palpate the spleen. Okay, now we're going to be looking at the lower extremities. Lower extremities appear symmetrical, skin is dry, intact, hair evenly distributed on both legs. Palpating for pretibial edema, which none is noted. Checking inguinal nodes. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Checking for femoral pulse. Femoral pulses are palpable +2 bilaterally. And now listening for any bruit with my bell. Freya Brui and the femoral pulses bilaterally. Moving on to pulses, dorsalis pedis pulses are +2 palpable bilaterally. And posterior tibial pulses are palpable +2 bilaterally. Toes appear pink. Nail beds are without clubbing or cyanosis noted. And capillary refill is +2. Okay. Now we're going to check range of motion exercises. We're going to check range of motion in your hips. If you'll go like this, and up, down, and back. Good. Range of motion is intact in the hips. Now knees, we're just going to bend up and down. Great. Great. Go ahead and point your feet up and down. And then can you move them out to the side and back in? Great. Range of motion in the feet are intact. Go ahead and put this heel and slide it down your shin. Okay, good. Go ahead and do that to this side. Okay, good. Now we're going to get up and check your reflexes. Swing your legs around to the side here, sir. Check your patellar reflexes. Patellar reflexes are +2 bilaterally. Achilles reflexes are +2 bilaterally. Checking for a Babinski. Babinski is negative on patient. Go ahead and get up, sir. Okay. We're going to have you walk to the fridge. Great, turn around. Come back to me and go heel to toe, heel to toe. Okay. Now go back and we're going to go on our tiptoes. Okay. And now we're going to walk on our heels. Great. And then stop. Close your eyes. Great. Negative for Romberg sign. Go ahead and bend your knees like this. Great. Quads and hamstrings are intact. Now moving on to your back. Back appears symmetrical. Go ahead and bend over for me. Cervical, thoracic, and lumbar spine appear intact. Okay, go ahead and stand up for me again. Scapula, iliac crest, and gluteal folds are intact. And now we're going to finish with some range of motion exercises. And if you'll go ahead and bend again. Great. Twist to the side. Great. And then out and in. Good. Well, that concludes our assessment today. Thank you so much.
Thank you.